going to be your nurse today. I'm just going to be looking you over from head to toe. I'm going to be assessing just your general appearance, your skin. I'm going to listen to your heart and your lungs, and then look at your head and your neck. Can you introduce yourself for the video, please?
Hi, I'm Jenna.
She's so wonderful to let me do this. This is fun with her. So as I came in, I'm going to provide privacy. I'm going to perform hand hygiene before I do any type of assessment on you. I'm just going to start by looking you over from head to toe. I'm going to note any abnormal, obvious deformities, which you do not have any. As she walks in, I'm going to assess her gait and her mobility, her range of motion, and see if there's any involuntary movements, which I don't see at all right now. I'm also going to look at her clothing, making sure it's appropriate for the season, which it is. She's layered up for the ice storm that's approaching. Also just going to make sure she's clean, neat, and well kept. First, I'm going to begin with just an overall skin assessment, skin and hair. I'm going to just first look through your scalp, making sure there's no abnormal hair loss, receding hairline, which everything looks good for your age. Have you noticed any changes in any moles, any rashes, any lesions that I should be noted?
No.
Okay. I just want to make sure to remind you as you see anything to let your primary care provider know of any changes. You are your best inspector, so if you notice anything different, you make sure you bring that up. Gonna look just overall throughout the whole assessment, but intentionally right now I'm gonna make sure that you are pink, warm, and dry. I'm gonna look at your hands, make sure there are no rashes or lesions. Gonna make sure there's no excessive moisture on your palms, which that all looks good. I'm gonna look at your nail beds. I'm gonna make sure that you have rapid return, less than 3 seconds. I'm gonna look at your turgor, gonna pinch, and there is also rapid recoil, less than 3 seconds, which means you're hydrated. So that's really good. And overall too, I'm gonna look at your posture and your mood, your affect, which you seem very pleasant and happy to be here today, visiting Sarah. I am gonna just listen and make sure your speech is clear throughout the assessment. As I ask you questions, make sure you can hear me appropriately and just overall assess your overall nutrition. I'm going to be examining your head and your face right now. So first I'm going to look at your eye contact, and you're making eye contact with me, so that's good. I'm going to ask you a couple questions. Can you tell me your full name?
Jenna Lee Kilgallen.
And your birthday?
February 20th, 1989.
Great. And can you tell me where you're at?
Sarah and Jason's house.
Great. And why you're here?
Why? We're here for a visit.
Great. And what year is it?
2014.
Okay. And so she's oriented ×4. So now I'm just going to kind of look your head and your face over. Your face is symmetrical. I'm going to feel on your scalp. I'm going to feel for any lumps or bumps. I'm going to feel back behind your occipital. Good. And I don't feel any abnormal. Do you have any sore spots on your head? Any problems? Okay, good. Next I'm going to feel your temporal artery. And now I'm going to move down to your temporal mandibular joint, your TMJ. Can you open, close, open, close? Good. Nothing is getting stuck or locked. And now I'm going to feel your sinuses. I'm feeling your frontal and your maxillary. Do you feel any pressure, any pain? Oh, great. I'm going to do your eye exam. So first I'm going to begin with just looking. Your eyebrows are symmetrical, there's no depression. Eyelashes look good, they're growing out in the correct direction. Then I'm going to look at your sclera, and it's white like it should be. Yellow could mean jaundice. I'm going to pull it down, look at your conjunctiva, and it's pink. So that's great. Next I'm going to shine a light. From back here I'm going to do the red eye reflex. I'll look from back here, and that's good, and good. And while I'm looking, I'm just looking at your pupil, your iris, your lens, cornea, just looking at all of the above. and making sure that they are also symmetrical and that there are no foreign bodies found. Now I'm going to use the light again. I'm going to check your pupil, constricting and dilating. So I'm going to shine this light on your eye twice, each side. First I'm looking at the same side and making sure it constricts. Now I'm looking at your opposite eye and making sure it constricts as well. Great. Alright, sorry, I know it's kind of bright. It's okay. Okay, now I'm going to have you look at my nose and then look at the back wall. And my nose and the back wall. Good, and for that I'm just testing her accommodation. So your pupils are about a 3 millimeter in size. They're equal, round, and reactive to light, and they are accommodating. So next I'm going to check your peripheral vision. So I'm going to move my fingers forward and you tell me when you can see them. This is the confrontal test. Good. Good. Great. Okay. And then next I'm going to check your cranial nerves 3, 4, and 6. I'm going to test your 6 cardinal gazes. I'm going to just have you follow my finger and tell me what number I'm holding up, all while you're still looking at my nose, okay?
1, 2, 3, 4, 0.
Good. Okay, and then I will explain how to do the Snellen and cover test. The Snellen test is the big chart, and you would step a certain amount of feet back and see how many lines on it you could read. In the cover test, you would cover one eye and see if there's any differences between your left and your right eye. Alright, next I'm going to do the ear exam. So first, I'm just going to take a look on the outside. I'm going to make sure there's no discharge or drainage that I can see. And now I'm going to perform the whisper test. So I'm going to have you occlude your right ear. I'm going to whisper something. You tell me what I say.
Apple.
Good.
Baseball.
Very good. Alright, and then next I'm going to use my otoscope and I'm going to look at your internal canal. I'm going to be looking at your tympanic membrane. I'm going to be also looking to see if there's any inflammation, but it's a pearly white color, so that's good. Looking at your bony prominences. I'm also going to be pulling up and back, since you're an adult, on the pinna, and also making sure I don't put my otoscope in too far to make sure I don't hurt you at all. But everything looks good. Alright, next I'm going to assess your nose. First I'm just going to begin with making sure it's symmetrical, and making sure there's no obvious deformities, no discharge, or anything abnormal. I'm going to test the patency. I'm going to have you occlude one side. See if you could breathe in. Good. And now the other side. Good. Alright, next I'm going to shine a light on your nose. I'm going to be assessing the mucosa, making sure it's reddish pink. Yeah, I'm going to tilt your head up. Good. Set this on the inside. I'm going to be looking at your septum and making sure there's no deviations in your turbinates. Alright, that's it. Right, now I'm going to assess your mouth and your throat. I'm just going to start like any other assessment by looking at your lips. They're not dry or cracked. I'm going to have you open your mouth. I'm going to just look at your teeth, make sure none are missing or chipped. Look at your gums, making sure they're pink, making sure inside of your mouth is pink and moist. I'm going to shine a light. I'm going to have you stick out your tongue and say ah. Ah. Okay, and I'm checking your uvula, making sure it hangs midline, it moves. Looking at your tonsils, making sure they're not red or any white patches, which can mean strep throat. Looking at your hard and your soft palates, looking at all the mucosa membranes. Have you lift your tongue? Very good. Alright. Your neck, I'm just going to start. I'm going to look and make sure your trachea is midline, no visible lesions or masses. Making sure your head sits straight for torticollis if it was tilting one way or another. Going to check your carotid pulses. Now I'm going to just be assessing your lymph nodes. I'm going to use the pads of my fingers, 2 or 3 fingers. I'm going to move in a circular motion. I'm going to feel that they are mobile, and that there's no tenderness, that they're not hard or fixed in a start with your pre-auricular, move to your post-auricular. I'm going to move down to your tonsillar, and then your submandibular, and then your submental right underneath your chin, and then your anterior cervical, and your posterior cervical, right behind the sternocleidomastoid. Good, and then I would have you turn your head to the side to check for the deep cervical, but a lot of times you can't feel for that. And then I'm going to do your supraclavicular and your infraclavicular. I'm going to feel from behind your occipital. Okay. Next, I'm going to palpate your trachea. I'm going to just feel here on your neck. I'm going to displace it from one side to another, making sure that it's been long. Good. And next, I'm going to check your thyroid. So I'm going to have you turn to the side. I'm going to do the posterior approach. I'm going to feel on both sides. I'm going to feel for your cricoid cartilage. Feel on the outside. I'm going to have you swallow. I should feel it move up, move down. I'm checking the lobes for any lumps or bumps, any tenderness. Is there any tender at all? Good. It shouldn't be painful at all, and everything I found was normal. That concludes our head and neck assessment. Right, now I'm going to assess your lungs. First, I'm just going to inspect. I'm going to check your rate of breathing, making sure you're not taking shallow breaths, which you're breathing just fine. I'm going to palpate and feel for any subacute air, which would feel like little Rice Krispies. I don't feel anything. I'm going to check for tactile firmness. I'm going to have you say 99 as I put my hand between your intercostal spaces, and I should just feel the vibrations.
99, 99, 99, 99, 99, 99.
And as I do this, I'm just making sure it sounds, it feels symmetrical as you're saying that. And then I'm going to go ahead and auscultate. I'm going to listen. Every time I move my stethoscope, I'm going to have you take a deep breath. I'm going to start with the inner 1/3 of the clavicle. Down to the second intercostal space. I'm going to do the ladder approach so I can listen to both sides. Make sure her breast sounds even on each side. I'm going to have you lift up your breast tissue. Good. Alright, and I'm going to have you turn around and face this way. Again, I'm just going to inspect the back side. I'm going to make sure that her breaths aren't shallow, that her chest thoracic cavity is expanding symmetrically. I'm going to place my hands on the side next to her spinal cord. I'm going to move it as you take a deep breath in and out. As she's doing this, I'm just making sure my hands are moving symmetrically along with her breath. Make sure that she's not using any accessory muscles. You can check this anterior and posteriorly. Also, I'm going to make sure there's no masses or tenderness. Do you feel any pain when I do that?
No.
Okay, next I'm going to percuss. I'm going to listen and make sure there's no dullness. So I'm avoiding the scapula and any ribs. Good, and it should just be a resonant sound. Again, I'm going to do the tactile firmness. I'm going to have you say 99.
99, 99, 99, 99, 99, 99.
Good. And now I'm going to auscultate just your back side. Again, I'm just going to start at the top. I'll have you take a deep breath in. Again, I'm just making sure I'm avoiding her scapula. Skipping the 5th, moving down to the 7th. And have you put your arms out in front of you and listen. I'm just listening for clear breath sounds bilaterally, anterior and posteriorly, just comparing all of your breath sounds, making sure I don't hear any wheezing or any crackles or anything like that. Some additional tests that I could do would be the whispered pectriloquy. And I'm going to have you whisper 1, 2, 3 as I place this on the back. And as I'm doing this, I can see you whispering it, but I can't hear you, which is good because that means there's no consolidation. And then the next test is the bronchophony. And again, I'm going to have you say 99. And as I'm listening, I should hear you say it. I shouldn't hear you through your chest, though. That would also mean no consolidation. So as I move this, have you say 99?
99, 99, 99, 99.
Good. And like I said, I can hear you saying it, but I can't make out clear enough the 99s. And my last test is the egophony, and I'm going to listen. I'm going to have you say the sound E. And if I hear the E, then that's a good thing. If I hear it turn into an A, that would be an abnormal finding. Oops.
E, 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 E.
Good. And that concludes our lung assessment. Next, I'm going to be assessing your heart sounds. I'm going to first listen with the diaphragm and then the bell of my stethoscope. I'm going to start over here on your right side, the second intercostal space next to your sternum, then the second intercostal space on your left side. I'm going to move down to the 4th intercostal space. I'm going to end at the 5th intercostal space, midclavicular line. I'm going to listen there for a minute at your apical pulse. I'm going to note any sounds. I'm going to note if there's any murmurs present. I'm going to listen for the S1 and S2 sounds. The valves that I'm listening to are your aortic, and then I'm going to move over to your pulmonic, move down to your tricuspid, and then end at your mitral. Okay? And of course, in an actual hospital setting, you'd be wearing a gown, and I would listen skin to scope. And here I would listen for a full minute and note how many beats per minute I hear. And do the same thing. Very good. And that concludes that assessment.